Hi everyone, I'm Dan Depew, the Communications Officer with Middletown Medical, and I'm here today with Dr. Darren Patel, who is a gastroenterologist here with Middletown Medical. Dr. Patel, welcome.
Oh, thank you.
We're here to talk about colonoscopies, which is a topic that people maybe don't think about, but it's one that's really important, especially right now where people have put off procedures and things like that because they're afraid of getting sick coming out into the environment. But I want to talk first, Dr. Patel, how long have you been doing colonoscopies in the region?
I've been doing colonoscopy since 1995, and I do about close to 1,000 endoscopy, colonoscopy together a year.
And do you do them here at Middletown Medical, or you do them in the hospitals? So?
Do them here in Middletown Medical, do them in hospital outpatient settings, and also hospital inpatient if the patient gets admitted to the hospital.
What's the time frames in which it's pretty much suggested that you should be getting a colonoscopy?
Time frame, it depends on the patient's risk factors and the family history. Otherwise, the colonoscopy screening usually starts without any family history or any symptoms at age 50. And if you do have any risk factors or any family history, then it starts earlier than age 50. Then you cannot wait until 50 years age. And once the colonoscopy is done, if you don't have any polyp, then the time interval would be 10 years if you don't have any risk factors. If you do have risk factors, negative colonoscopy, then it's 5 years. And if we do find a polyp, then it takes, I would say, after 3 years.
Okay. So if you do find something and you want to get another look a little bit more often than the recommended time.
Because then those patients are at more risk of developing more polyps.
Interesting. So there's a thing called a Fecal Fit Test, which is where they send a kit out and someone can basically swallow a pill, or they could do that, or explain how that works. The Fecal Fit Test.
No, Fecal Fit Test is a different. It's a stool test, and that's done every year.
Okay.
And that picks up your blood, hidden blood in your stool. And if you do have any hidden blood, that requires a colonoscopy exam. And there is a new method out there for the pill cam for the colonoscopy, but it's not available yet. And it's not FDA approved or anything, so it costs very much high price.
May not be covered by insurance and
None of the
things like
insurance
that.
company covers it, and it also requires the same colon cleansing prep as a colonoscopy.
Right. So with COVID-19, there's new procedures in place. There's been executive orders from the governor, and we've done a great job here in New York State of really beating back COVID-19 as we roll into the fall. Talk a little bit about what it takes in order to come and get a colonoscopy right now in our procedure suite.
So right now, according to Department of Health regulations, every person who has scheduled any procedures, either in the doctor's office or in the hospital settings, outpatient, requires COVID testing within 5 days of the test. And without the COVID testing, nobody can have those kind of procedures.
Right. So I know that we have a drive-through COVID tent where you can literally call in, get a telemedicine approval for a COVID test, and then we set you up in the drive-through here in Middletown. We also do in-person COVID tests in our Newburgh urgent care office.
Mm-hmm.
So we've had a lot of good patient feedback about that.
Yep.
In fact, other practices have even sent us people to get the COVID test on here because it's really seamless the way we do it.
Mm-hmm.
I also know the regulations and rules set down, made it so we had to have testing as well for our team before they could do the procedures. And we've changed some of the ways that we deal with patients for the procedure suite, letting people stay in their cars. We call them right before they have to come in, and then we walk them to their car so their family doesn't have to wait here.
That's right.
What's the feedback you've heard from many of the people who have come back in for colonoscopies?
Usually it's positive feedback because we bring one patient at a time, so we don't have any exposure of one person to another person, and whoever is giving right to the patient, that right has to come up to the floor and sign their name in, and that person, the right person, goes back to his or her car, wait in the car, and then once the patient is ready to be discharged, we call them to bring the car up to the front door, and we bring the patient down.
Outstanding. Well, it looks like we've checked all the boxes to make it safe, and you know,
we have.
You always say that getting your colonoscopy is important, and that if you're worried about safety, there's way more things. Just going to the grocery store right now, here we're taking more precautions than anywhere else.
Yep, so, exactly. The grocery stores and those mall, they don't take much precautions about checking everybody whether that person has any sickness or not. We do over here.
Right, we're doing temperature checks, and we're checking symptoms, and we're also doing COVID tests before people can come in for procedures. So getting your colonoscopy or any procedure that you've been putting off, now's the time to get it done. And we are open here. We have 3 wonderful gastroenterologists who are working in the Middletown area, and Dr. Leidner and Dr. Patel up in Sullivan County. And here we have Dr. Padeswa and Dr. Patel here in Orange County. So we definitely recommend that now's the time to come back and get those needed procedures. Don't let time go by, because early detection saves lives.
That's true.
All right. Thank you, Dr. Patel.
Thank you.
All right. We'll see you soon.